This meeting is being recorded.
Hello, this meeting is being recorded. Good afternoon, everyone. For those I haven't had a chance to meet yet, my name is Andy Otteson, and I'm from the Berkshire Regional Planning Commission. And thank you for joining this afternoon to go over the Berkshire County and the opioid settlement. So quick overview, the municipal payments will begin arriving in June. This allocates over $4.5 million to Berkshire County over 16 years, and municipalities are encouraged to pool their resources together. The state will be able to provide support to form collaborative agreements, which they'll talk about later. The abatement terms outline several options these funds may be used for. As a reminder, these allocations were determined by the courts based on the impact that was caused by the companies covered in the suit from 2006 to 16. As such, the allocations in the distribution schedule we sent earlier are fixed. In addition to these municipal allocations, there's an additional $315 million allocated from the state to the Opioid Recovery and Remediation Fund Advisory Council. As we sent out earlier, the ORS key strategies and proposed uses align very well with our current efforts in the county. So as a quick overview of potential local uses for the settlement funds, these in broad buckets, these can be used for opioid use disorder treatment, supporting people in treatment and recovery, connections to care, harm reduction, addressing the needs of criminal justice involved persons, supporting pregnant or parenting women and their families, including babies with neonatal abstinence syndrome, and preventing misuse of opioids and implementing prevention education. So go into a little bit more detail on those. For opioid use disorder, we can look at expanding mobile treatment, telehealth, and recovery services, supporting withdrawal management, enhancing and expanding our existing treatment facilities such as Breen, McGee, Spectrum, Savita, ALC, Commonwealth Collaborative, and many others, as well as treating trauma for those with OUD and their families. For people in treatment and recovery, there's a long list, including wraparound services, housing, peer support, legal and social services, peer recovery services, nonprofits, faith-based communities and recovery programs, and bereaved families and frontline care providers. Digging in a little more on those, for wraparound services, this can include job placement, training, interview coaching, community college vocational school, transportation, and/or childcare. You can also look at providing housing to people with OUD, including supportive housing, recovery housing, deposits, utilities assistance, and rehabilitating properties for low threshold and recovery housing. So in a quick moment, just to clarify some of those definitions, residential treatment programs typically include a structured medical component with 24-hour supervision, mandatory services, and a highly structured environment over usually about 90 days or so. Recovery housing is abstinence-focused and a peer-supported community for those in recovery. So less restricted structure, but still will often include 24-hour staff, access to treatment, and a high level of services and support. Low threshold housing, also known as Housing First, is a newer model, especially it has gained a lot of steam in the past couple of years. This model assists individuals with chronic homelessness and mental health concerns, including substance use, by immediately connecting them to permanent housing and wraparound support with no preconditions. The Pathways model leases market rate apartments, and in a recent panel, they report that with no pre-existing expectations, most participants, quote, did what we would have wanted them to do anyways on their own, with about 2/3 self-selecting some form of treatment within 6 months. In addition to HUD funds, the state also has 2 open procurements for supportive housing and low threshold housing. Local and private funding could also be used to support these housing portfolios. The settlement funds can also be used for peer support specialists to help individuals access treatment, trauma-informed counseling, harm reduction, healthcare, and other recovery services. It can also provide social and legal services to assist those in deinstitutionalizing persons with OUD. We can also look at supporting or expanding peer recovery centers, which can include support groups, social events, computer access, or other services. Our own rural recovery resources in Great Barrington will be hosting their grand opening on Saturday from 12 to 2, 67 State Road, and we hope to see you all there. You can also support nonprofits, faith-based communities, and recovery programs in schools and the community to support people in recovery and their family, and also support bereaved families and frontline care providers. For connections to care, you can look at supporting post-overdose response teams to connecting individuals to recovery support, harm reduction, and other services. BRPC, BHR, Northern Berkshire EMS, County Ambulance, and many organizations are working on piloting BPOP, which is an EMS and harm reduction-based post-overdose outreach program that we ultimately plan to expand county-wide over the coming months. We'll also look at school-based services for prevention, treatment, and early intervention for younger people, such as the Patrick Miller Program, as well as funding services for young people who may be struggling with substances or mental health concerns. There's also fire department partnerships, such as Safe Stations, which offer a bridge to recovery services from firehouses. For harm reduction, we can also increase the availability, education, and training for Narcan for people who use drugs, their friends and family, first responders, overdose patients, schools, community organizations, and the public. As of March, 63% of police and 75% of fire in Berkshire County now carry Narcan. For your municipality, if you'd like to resupply your first responders, you can reach out to our own Stephen Murray. Narcan training is also available from Berkshire Harm Reduction, Rural Recovery Resources, and many, many others. We can also approve and fund syringe service programs and other harm reduction services, including supplies, staffing, space, peer support, fentanyl checking, such as Berkshire Harm Reduction's new testing device at the Pittsfield site, naloboxes / harm reduction vending machines, and the full range of services that these programs offer. We can also look at mobile units that offer harm reduction, treatment, recovery support. Berkshire Harm Reduction recently launched their mobile unit. If you were at Berkshire Pride on Saturday, you may have seen it there. As of April, 21 municipalities have approved a local control letter that will allow services through the BHR units. The state also currently has an open procurement for mobile methadone units, which can be a great way to help overcome transportation barriers to access medication. We'll also look at promoting efforts to train healthcare providers, students, peer recovery coaches, and other professionals. Enhancing training for medical practitioners, including increasing bupe prescribers, is one of the key priorities of the Healing Community Study that will launch in July. We'll also connect individuals involved in the criminal justice system to harm reduction, treatment, recovery support, healthcare, prevention, job training, employment, and other supports. We have new initiatives such as Second Street Second Chances and Project North that will also serve these individuals and their families. This can also be used to support co-responder models, such as the program with Breen and Pittsfield Police, and also look at alternate response models. For those who haven't heard yet, the federal government has recently announced over $40 billion in funding over the next 10 years to enhance the 988 suicide prevention line, which will be starting on July 16th, to ultimately provide a continuum of care where a person in crisis would call 988, a mobile crisis team would respond, and when needed, connect that person to a community health center, then later provide post-crisis wraparound services. The state is also proposing to provide a structure and funding, as well as additional funding for alternate response models. The federal government's goal is for over 80% of individuals to have access to these mobile crisis responses by 2025, and for over 80% to have access to these community health centers by 2027. That is a substantial change in public health that we can look forward to. We can also look at supporting public safety-led diversion strategies, such as the LEAD model, crisis intervention training, and mental health first aid training for all officers, as well as membership organizations such as PARI. For parents in recovery, there's also First Steps Together, which is a home visiting program, as well as residential treatment programs for pregnant postpartum women and their families. There's also the Moms Do Care recovery support program that has recently grown to 10 programs in the state, although Greenfield is currently the closest to the Berkshires. We can also look at implementing support programs, policies, and practices for youth prevention, as well as supporting community planning coalitions such as BOPSI and the South County Opioid Working Group. We could also look at providing additional support to community education and support for families, youth, and adolescents. We have some fantastic organizations in the Berkshires, such as Northern Berkshire Community Coalition, Railroad Street Youth Project, Young People in Recovery, and many others. And we can also look at supporting greater access to mental health counseling and services for young people, including in schools and the community, to address their own unique needs that might increase their risk of future substance misuse. Told you it would be a lightning round overview, and don't worry, we will be emailing this out later. Everything that we covered, though, and a lot more is sorely needed in this county. Again, we're looking at $4.5 million over the next 15 years. That comes out to roughly $281,000 per year. In the weeks, months, and years ahead, the municipalities will be tasked to make some very hard choices on how they want to optimize these funds, taking a closer look at what services and prevention efforts we have in place, what gaps there are that need to be filled, and how else these efforts can be supported. That is the end of my piece. If you have questions or comments about services that we already have in place in the county, happy to follow up with you at any time. Just shoot me a quick email. And with that, it is my distinct pleasure to turn it over to Jillian Feiner from the AG's office.
Hi, everybody. My name is Jillian Feiner. I'm Senior Enforcement Counsel in the AG's office, and I have primary responsibility for overseeing the opioid investigations and litigation, and now for implementation of several of the settlements. And I think also presenting today, Andy, I don't know if you're going to get to this, is going to be Dee Calvert from BSAS. And Dee, I don't know, do you think it makes sense for you to go first or shall I?
Either way, I have my slides hopefully ready. We'll see.
Well, I'm happy to go because I've been introduced, and then I'll turn the podium, the virtual podium, over to you. So let me just take a moment. It's lovely to see you all. Thank you for having me to figure out how to share. And I think I want to do this. Can folks see my,
Yep.
There we go. And I think, okay, are we all good? Great. So again, my name is Jillian Feiner. I've been working for AG Healy since 2008, and in around 2017, I took on sort of primary responsibility for some of the office's work involving Purdue and the Sacklers, and also the distributors in Johnson & Johnson, among others. Today, I'm going to cover with you a few of the AG's recent statewide opioid settlements, the Massachusetts State Subdivision Agreement, which governs sort of allocation and uses, and Andy touched upon already. Payment amounts, timing, and mechanics, some of the municipal reporting obligations, and hopefully, direct you to some additional information and gather some feedback too. So first, not all settlements that the AG's office reaches are statewide settlements. So what do I mean when I say that? Statewide opioid settlements are AG settlements where Massachusetts municipalities, cities, and towns are eligible to receive direct payments in exchange for signing releases. So far, we've finalized statewide opioid settlements with 3 of the country's largest opioid distributors, AmerisourceBergen, Cardinal, and McKesson, and opioid manufacturer Johnson & Johnson. The way that these settlements are structured, the more cities and towns that sign on, the more the state as a whole can recover. In Massachusetts, we have very robust participation, so we are due to recover the maximum abatement funds available under the settlements, and that's over $525 million over a period of years. And I'm just going to flag for everybody that as we go through this presentation, and I'll provide a copy of it to Andy, there are some yellow words that are links. So here you see on this slide that the word participating is linked. There's a list on our website of all of the 341 cities and towns that have signed on. Those that haven't are just very, very small towns, which probably made the assessment that there wasn't much that they could do with their funds. So next up is the state subdivision agreement. This state subdivision agreement was signed by the vast majority of our cities and towns, over 264, and entered by the Massachusetts Superior Court. And it specifies how the funds from the statewide opioid settlements can be used, and Andy touched on some of that, and how they'll be allocated within our state. Under the terms of the agreement, the state and its municipalities must direct 100% of the recoveries from these statewide opioid settlements to prevention, harm reduction, treatment, and recovery. 60% of the recoveries will go to the State Opioid Recovery and Remediation Fund, and 40% will go directly to the municipalities. The agreement also requires that municipalities that receive annual payments of $35,000 or more make annual reports to EOHHS. And the $35,000 threshold it includes sort of municipalities that are receiving that money just on their own, and also where they elect to pool. Pooling funds, as Andy mentioned, is allowed, including through the Office of Local and Regional Health, which has shared service agreements, and which I understand has shared service agreements that affect 277 Massachusetts municipalities. 277, in other words, are already part of regional collaboratives supported by this office. So one question that I've been getting a lot recently is, when are payments coming and how much? There are charts on our website that show the total anticipated payments by year, and also broken down as between the distributors and Johnson & Johnson. And this is just helpful because you'll see that the payments over years aren't flat, and I wanted to make sure that municipalities and collaboratives had enough information to sort of do some medium and long-term planning for the funds. The soonest that a payment could come would be this month, June 2022, with the rest of the 2022 payments likely coming next month. That would be the second payment from the distributors, as you can see on the chart, and the first two payments from Johnson & Johnson. And that's because we were negotiating these settlements for so long that the payment one is essentially from last year and has been escrowed. So we're going to receive probably 4 payments this summer, and then 2 payments every July, mid-July after that for the duration of the payment term. Just flagging that payments 3 and 4 that from Johnson & Johnson could be made sooner in 2022, depending on certain contingency, whether we meet certain contingencies in the settlement, and that remains up in the air. But that's possible, and we'll have more information about that in the coming month or so. So payment mechanics. Probably the slide says this month. I'm going to say to you all today or tomorrow, possibly, municipalities that are participating are going to get instructions from the third-party settlement administrator that's been hired by the states to oversee administration of this settlement, inviting them to set up an account in the National Settlement Portal, and also submit their W-9 and the required payment elections. The election form, which I have reviewed, appears to me to be very simple. It essentially requires an election between a check and a wire, and some relevant contact information for the town. And I think it may also enable municipalities to elect to delay the first distributor payment, which could come this month, into July, so that it doesn't come until the next fiscal year. Once those steps are completed, payments can begin to flow. So back to the annual reporting for a second. Under the terms of the state subdivision agreement, municipalities that receive funds totaling $35,000 or more will need to report on their expenditures, unexpended balances, any unexpended balance they have, efforts they undertook to incorporate input from members of the community and experts, efforts to address disparities and improve health equity, and their efforts to leverage existing programs and services. I'm also hoping that the reporting forms will provide municipalities an opportunity to report on their successes, lessons they've learned, barriers they've faced, and areas where they think further progress is possible. And I expect to put more guidance on that up on our website in the coming weeks. I have been keeping that AGO website pretty regularly updated. I've attached here or put on the slide the links to documents and information about the AG's statewide opioid settlements, everything from the settlement documents themselves to charts breaking down all of the payments, answers to questions that we've been getting frequently, and our email address. That's me, Mass Opioid Settlements. And if you email me, I will respond promptly. I'm particularly interested not only in hearing from municipalities about sort of the administrative nature of their issues, but also like the types of programs that they want to fund, whether they're considering pooling funds, including through existing shared services agreement, the types of barriers that they're facing, and the type of state support that would be helpful. Obviously, I view the settlement as a tremendous opportunity for the state to fill gaps and to innovate. I know a lot of the funds that municipalities and collaboratives receive have a lot of strings attached. And one of the amazing things about this money is that that's not the case. So I think it's a real opportunity to expand services and learn together about how to deliver, what people really need better. So I look forward to continuing to work on all of this, and I'm happy to take questions now, or if you want to kind of switch presenters to Dee, I'm happy to handle it that way as well.
Carl has posted a question in the chat.
Carl's asking if the Purdue Pharmaceutical part of the settlement is part of this, or my understanding is that will be part of the next wave of settlements with the other insolvent companies.
Yeah, that's correct. So there is this is a frequently asked question, and so we have an answer on the website, but no, right now, the money that we're talking about coming in really just relates to the distributors and Johnson & Johnson, and money that we receive from bankrupt entities, including Purdue and Mallinckrodt, will be treated a little bit differently in accordance with approved bankruptcy plans. So today we're only talking about distributors and Johnson & Johnson.
Also, just to clarify with Purdue, is it anticipated that those would go into the ORF fund as well, is my understanding?
Yes, so subject to the money gets treated a little bit differently. The state subdivision agreement applies to non-bankrupt entities. For bankrupt entities, the money would go into the ORF, and there are sort of regional apportionment requirements that need to be accounted for, and we'll be kind of building out some of this on the website as those monies start to come in. I anticipate that the first money to come in through the bankruptcy process to the ORF will actually be from Mallinckrodt, which was a very significant opioid manufacturer, mostly in the generic space. We are expecting that the bankruptcy plan will become effective probably sometime this month. I don't really have control over that, but that's the current expectation. And that payment one would go into the ORF sometime in the fall. And that's going to be for a smaller amount. I mean, I think we're talking about, depending on how fast the payments are made, somewhere between like $18 and $22 million over a period of years.
Great. Representative Farley-Bouvier.
Thank you so much, Andy. And I just want all of us to just sort of take a moment, take a breath, and say a great big thank you to Jillian and to her boss, because this work is really incredible. The Attorney General has been absolutely unafraid to take on the opioid epidemic in the way that her office could. She did not back down. She did not settle for a much smaller settlement that some other states did. She's one tough cookie, and I'm really pleased with how the lessons from the past, think tobacco settlement, and what didn't work about that is being applied to this. And the fact that you're here today, Jillian, and talking to us about how this is going to work. And then I can see from Carl's question how the smaller towns can get together and we can start pooling resources is going to be so important. So I just wanted to take this moment to just give the biggest thank you to you and to the team at the AGO. So thank you.
Thank you. I'll turn it over to Dick Alcombright.
I thank you. Very well put, Madam Representative. Thank you for that. And certainly thank you, Jillian and the AG. I've been a little bit of a part of this for quite a while, and it's just astounding the way this was written and the way it's been delivered. What I want to say is that a question, Jillian, would be simply this. The monies are forthcoming. You say we may receive like 4 payments, like initially, however that works. There is no urgency to spend the money, in as much as once the money comes, for instance, if you don't spend it in that year, you don't have to give it back, correct? How would that work? My concern is simply this: for all the good reasons and all the with best intentions, people are kind of scrambling, like, what do we do with the money? And I'm just so hoping that communities will be particularly thoughtful. I like what Carl said about how we can come together as smaller communities and make better and bigger efforts, but be particularly thoughtful in understanding that and remembering that the dollars that are coming forward come off the backs of those who have died and their families, that we need to, in a sense, represent with the best we can do with this money. So in my opinion, it's more critical how these funds are spent than, quite honestly, any other funds we've come forward because of the backstory. So with that, I'll be quiet and please answer on the money, please.
Well, first, nice to see you, Dick. And thank you for the question. It's a good one about how fast you have to use the money. Under the terms of the settlements themselves, there's no requirement. And for the ORF, just in thinking back to how that statute was drafted, there is also not a requirement. Although, of course, I know the secretary is going to try to make good use of that money as fast as she can. However, from a municipal finance perspective, I think that there are relevant laws that apply to this, and I'm not a municipal lawyer, but I do think that this is an issue that municipalities have to be cognizant of. I understand that the Department of Revenue is actually has made a proposal in the SUP budget to enable towns to keep this money as special revenue instead of putting it into their general fund. But ultimately, I think it probably does make sense to worry a little bit about how fast you need to spend these monies once they come in, which is why I've been working with the settlement administrator to make sure that cities and towns can elect to delay any kind of June payment till fiscal year 23. And folks should consult with their municipal lawyers. I know a lot of towns are represented by KP Law and others. This is a good question for them and one that it makes sense to get on top of.
Thank you. I'll jump to the question in the chat from Carl, and I think we kind of piggyback Mary Beth's question onto that. If you could talk a little bit more about the formal process to engage neighboring communities, as well as facilitating meetings across the municipalities. By the way, we will keep this channel open after the Attorney General's office is done. If any of the municipalities would like to stay around and start to have some initial conversations about that, if you haven't been already.
So this question is a little bit out of my lane, but I think that we have somebody from the Office of Local and Regional Health on. Erica, are you on?
I am on. So we have a model that's in place right now, and the Berkshire the Berkshire Public Health Alliance is such a model. What we have is the Public Health Excellent shared service arrangements. We have now actually 50 and 310 municipalities are part of it. And the Berkshire Public Health Alliance is one of our PHEs, including Tri-Town, which is the southern part. So we have models that are in existence where smaller municipalities are, I believe Clarksburg is part of that PHE and is part of the Berkshire Public Health Alliance. So you actually have a system in place to pool your funds, to talk about how you could pool your funds, to look at, I believe actually right before COVID, the Berkshire County did a community health assessment. So the gaps and where are some areas to pool your funds together to address some of those gaps, there is a model there already. So I would actually utilize that model to really think about how you could pool your resources together and address some of those gaps.
Great, thank you.
I would add is that there's in my presentation, there's a link to at least the 47 shared service arrangements that existed before I started talking. Now I'm hearing there are 50. That's wonderful. The link should take you to all of them.
Great, thank you. Mayor Tyre?
Thank you so much, Andy. I'm really happy that we've convened today because I have felt a little bit at loose ends, not really understanding this opportunity that we have to strengthen the services that we provide. I'm really glad, Jillian, that you mentioned the Department of Revenue because I have some anxieties about from an administrative standpoint and and a financial management standpoint, what are the expectations of the Department of Revenue? How are we to manage and report these funds? The point that that Mayor Alcombright made about the speed with which we have to spend, and feeling that pressure to hurry up is not going to lead to good planning, good implementation, good execution, and good outcomes. So I really hope the Department of Revenue is going to give us the flexibility that we need to plan for really, really good programming. And the thing that I am the most interested in at the moment anyway is the 988 systems. And I know that the federal government is about to release a federal program to provide 988 to states. And I guess I would ask Representative Farley Bouvier if you could take a minute to give us an update on whether or not our state is ready to adopt the federal 988 program. I was looking at some maps, and it looks like Massachusetts is among some states that have not yet adopted whatever's necessary for us to get into the federal program. Maybe I've misunderstood that, but could you give me a little bit of an update on the 988? Because I feel like that's the area of interest for Pittsfield in particular, and maybe there is a way for us as a region to really, really do something transformative with that type of program.
Thanks for the question, Major. I do not have an update for you on that, but I can certainly get it.
Thank you for that. I'm struggling to understand what is the federal 988, what is the state 988, and how does that, like, how are we going to bring that home, like right here home? That's the thing that I'm struggling to like understand how it's all works together. So thank you.
All right, thank you. And Deirdre, did you have some information you wanted to present as well, or did we want to focus on some of the other questions from the chat?
I have a whole presentation from the Bureau of Substance Addiction Services, but a lot of it's been covered. So I will try and not repeat things, but I'm happy to present. We've been working with the AG's office and very closely with Jillian Feiner, a lot more on, well, on both sides, but a lot on the ORF side, which is the state side. So I'm going to try and share my screen. And let's see here. You let me know if I can. I think my screen is coming up. Can you guys see it?
Yep.
All right, but I of course have a blockage in front of me, so I'm trying to get to the part where I can say go to slideshow. Slideshow, there we go. Play from start. All right, here we go, and I'll try and keep it brief so we can have more questions, but hopefully this might also answer some of those questions. And I'm also happy to answer about 988 from the Department of Public Health as best I can. So again, my name is Deirdre Calvert. I go by Dee, but I am the director of the Bureau of Substance Addiction Services for the Commonwealth, and I'm very happy to be here. And I was just going to talk quickly about the ORF specifically, some of the strategies, coordinating with other DPH funding, DPH technical assistance, and some of the reporting requirements that have already been mentioned. So just so everybody knows that the state trust fund is headed by the secretary. It's a 21-member body. Many are from Western Mass, some are from the Cape, and the whole state that we tried to include. So we began meeting in May of 2021, and we put out our first report in September of 2021. So just want to make sure I don't miss anything that you guys have already covered. So there's already been 4 initiatives that have come out of the ORF, and these are initial strategies that were identified by the council. This process will be ongoing, and it's also including the establishment of a strategic plan for the next 3 to 5 years for this, the ORF state spending. But the 4 categories that we identified at the beginning was the expansion of harm reduction services, increased access to methadone, expansion of supportive housing programs, including the permanent low threshold housing, which I can talk about a little bit, and the community outreach and engagement. So for expansion of harm reduction services, just to be clear, we being DPH BSAS, put out a memo in December allowing the purchasing of safer smoking supplies as well as other harm reduction kits. We are also looking at increasing SSPs throughout the state, which is, if I speak in acronyms, please stop me, that's syringe programs. We're looking at increased access to methadone for any providers that are here. We do have out right now an RFR and a application for mobile units, delivery, med units, any of those to, especially in more rural and hard to access places, to ensure that methadone is available. Expansion of supportive housing. Throughout the state, we've already housed permanently in the last year 160-ish people, with another 60 going to be permanently housed by the end of this month. We are going to house by the end of fiscal year 2023 over 300 people. Only 60 or 70 of those are in the mass cast, which people talk about all the time. The rest of these are throughout the Commonwealth. So that's really important, and we're very much committed to that. We're also looking at community outreach and engagement. As we know, I'm a therapist, and before I came to the state, I'm a therapist, and we put a lot of requirements on individuals who probably have the least amount of access. So thinking about cars and transportations, and then when they fail out of treatment, we blame them for not being ready. So we're really looking at ways that we can kind of bring them out into Muhammad, so to speak. As already been discussed, there's in the municipal settlement agreement, and the abatement details all of these disparities: system outcomes, race, wealth, stigma, mental health conditions. We're trying to fill the gap. And there was a tremendous amount of effort putting these together to ensure that these do not go the way of the tobacco settlements, which people have mentioned. The intent of this abatement is for harms caused by opiates in our community. And this municipal settlement agreement spells out approved approaches and includes a really broad range of strategies, as Ms. Feiner stated. So we've also talked about the shared service agreement. Some of the ones that you might be familiar with is the Mass Call 3. So we want to make sure that we can leverage any of those shared service agreements through the prevention or our CDC overdose data to action, or ODT2A funding. So we want to make sure that happens. We, DPH, we're going to be providing technical assistance. So these and other resources will be available on a designated page for municipalities to related to their ORF funding. So as Jillian had mentioned, there's a frequently asked questions, and she's got an AGO website. We've got the ORF website, but we're going to try and make one landing page that'll be really simple for everyone to come to. It'll be like a one-stop shop for all of your questions and resources, and DPH resources and reporting templates. So let's move on to that. So we are going to be releasing a reporting template so municipalities can prepare to complete their annual reporting requirements. We don't expect the first report until fiscal year 23. And we will also be collecting information from municipalities on the plans for the spending of these funds, so we can provide appropriate technical assistance and training. So we'll be doing that. Again, this was very quick because so much of this was already covered. So I want to stop sharing my screen and make sure if there's any questions. So while I do that, please ask questions while I get this off my screen.
You're going to mention the 988.
Oh, yep. So of course I want to get off the screen so I can stop sharing. Where's the little button that says stop sharing? So sorry. Stop share right there in red, right in front of me. So you think after 2 years, I still just get nervous when I'm in front of people trying to do this. 988. So I am not the person in charge of 988. 988 is going through our Bureau of Community Health and Prevention, and our wonderful Director of Suicide Prevention has been working diligently around ensuring that 988 is accessed. So as everyone knows, we've got a very robust system right now through Samaritans, and they're working on integrating. That's about as much as I can tell you, except they're working on it daily. What I would suggest is that you'd have somebody like Kelly Cunningham, who is the director of SAID and working hard to put this in, to come to your meeting. So there is at least somebody that you can talk to about where we're at, where it's going, and what's going to happen in the state.
Dee, could you put that contact information in the chat, please?
I sure can.
Thank you.
So in terms of ORF, in order for municipalities or counties or larger regions to put in requests for funding, what would the process be like? What would, especially from the state, be from ORF and from the state, be looking like from us?
So, I think right now they're really. I think that the thing to do would be to reach out probably to Josh Cuddy, who's the liaison for the ORF, and I think he's on this call. There's not a formal process right now, but I know that there have been a lot of inquiries, and that the council meets quarterly, and there's a possibility that issues can be taken up at these quarterly meetings. So I would say that that's probably the best answer for reaching out to somebody at the ORF right now. There's not a formal program right now for the ORF to make additional grants to, municipalities and collaboratives, but I think that nothing is off the table at the moment, and folks who want to make those kinds of proposals should reach out to Josh.
Are there other questions at this time? Following up on Carl's question from the chat, we have many resources available that I can send out later. And also, Dee, if I'm understanding correctly, on those links that you send would also include additional links to studies on methods of crisis management and harm reduction?
On my slides, I'm sorry, say that again, Andy. Sorry.
I believe one of the links that you had referenced that includes more resources. Would that include resources relating to approaches for harm reduction and crisis management?
I don't know about crisis management, but we should have the harm reduction. If they're not included, I'm happy to get you what we have, and I can make sure that they are accessible.
Great, thank you.
Andy, if I could just step in, Dee had actually included 2 primers and links to the primers. The Local Public Health Institute is funded by our Office of Local Regional Health, Department of Public Health, to train local public health professionals. And these 2 primers were funded by the State Opiate Response Funds, BSAS. And these primers actually work with local public health to look at what are ways that local public health right now is working to address the opiate epidemic. And so these are excellent primers because they give a lot of baseline information as well as a lot of resources and thinking about coalition building or working with coalitions and also harm reduction resources as well. So they're online modules, they're self-paced, they're free through the Local Public Health Institute. At the same time, the Massachusetts Health Officers Association, they actually have on their website an opiate toolkit, which has been revised, and they're going to be rolling it out. There's going to be a webinar on the rollout on June 29th for local public health on the utilization of that toolkit. It really centers around the 10 essential services that local public health focuses on. And it really provides an opportunity for real-time information all the way from prevention to recovery support. So there are resources available for local public health. And for a lot of our shared services municipalities, we're going to be promoting that to make sure that, that they have that information and participate in this.
Great, thank you. Additional questions or comments at this time? And again, you can use the raise hand feature, or you can go ahead and put it into the chat. Mayor Alcombright?
Yes, thank you, Andy. For both mayors, and I know I've spoken to Mayor Maxey, and thank you for your time, Mayor. But for both mayors, you probably know the Healing Communities study is coming forward in the city of Pittsfield and the city of North Adams, really totally effective July 1. We're fortunate to have Amber Bisa on the Northern Berkshire Community Coalition working towards forming the coalition here in North Adams. And I know Andy's busy working with a coalition in Pittsfield for Healing Communities. Healing Communities, without getting into it deeply, is really focusing on bringing funding towards solutions around harm reduction type solutions. So it's very, very similar, but there is going to be a good pot of money. That being said, my point is simply this: as these coalitions grow and become more involved, effective kind of July 1, I think it would be from the mayor's perspectives, I think it would be probably the most informed group and the largest group of people that and the most current discussions around topics related to harm reduction that you'll probably find. And please, Andy and Amber, please correct me if you think I'm wrong on that. But I think as these discussions go forward, I'm just thinking that it would be good for your offices to be in those discussions. I know you've been invited in, so that would be a great thing to help inform your offices and you as the one who will ultimately direct the money to do it in the best way possible. So just thought I'd throw that out there.
Thank you, Dick. I'll put a yes and on that. In addition to these coalitions that are forming around the Healing Community Study, there's a coalition that's starting up in South County as well with some absolutely fantastic individuals. We're also strongly encouraging those in South County. And again, for Healing Community Study, though the funding is specific to Pittsfield and North Adams, there's going to be spillover county-wide. So we would like everyone in the county, including South County, to please be an active part of these studies. We have the Pittsfield kickoff on July 7th. The North Adams kickoff is on July 8th. So we do encourage you all to be a part of it. This will be impacting everyone throughout the county. And again, for those of you who are looking for experts, looking for consultants, the BOPSI group, the South County Opioid Working Group, several other groups around town. In addition to these studies, there are some fantastic, hardworking, astonishing brains that have been working on this for years that I am delighted to have become a part of recently. DA Harrington.
Hi, good afternoon. Thanks so much to Jillian and for Dee for being with us today. It's nice to see everybody. And so, you know, I run a countywide organization, and there are definitely, you know, things that we would like to see happening on a countywide basis. Particularly, we'd love to be able to refer people that come into district court to recovery coaches. We'd be interested in providing services to, you know, families of people who have died from fatal overdoses. And we also we previously tried to get funding for the LEAD program. I'm really interested in having more like kind of outreach workers that could operate in the cities like North Adams and Pittsfield, but also throughout the rest of the community. So I guess I just put out those things that I'm particularly interested in, because I'm just looking for guidance in terms of how, as a county-wide organization, do you recommend we kind of work through this process when all these individual municipalities are getting these different kinds of funding? I'm not clear as to how this process is going to work.
I mean, I don't know if that's a question directed to me or not, but I think it would be appropriate for you to reach out to the individual towns and to talk to them about how they're anticipating using the money and whether they are considering pooling. And to the extent that they're considering pooling, still, again, like what their like plan is for this money.
If I can interrupt, my name is Mary Beth Mitz. I'm on the select board of the town of Lenox. And knowing that we're going to be receiving $338,000 a year for the next 16 years is pretty daunting. We want to use this money responsibly and productively to assist anyone in crisis, anyone who needs these supportive services. And so I think it's going to be very important for us to get together to really seek out successful providers of harm reduction and these supportive services that currently exist in the county, and provide our funds to those people who can collect statistics and show that they have, you know, families and individuals who require this support. We're towns. Towns don't have experience with opioid and substance abuse. I mean, I can say that from the town of Lennox's standpoint anyway. We don't have town employees who have that expertise. So I would feel more comfortable as a town, and I'm just speaking for myself here, I'm not speaking for the entire select board, that we find partners that we can assist by providing these funds so that they can expand their services, so they can expand their community outreach and the benefits that they provide to citizens in Berkshire County to help. So I would love to be part of a group of municipalities that discusses how we can, as the 13 municipalities, I think we have 13, we may have 19, I don't remember, how we can pool those resources successfully as a group and then be able to report annually and show that these organizations have increased their services and increased the people that they've assisted. That to me, I think would be success.
I just wanted to flag that I just dropped into the chat the spreadsheet for the payments by year and total, and the Lennox amount in the aggregate looks like it's the same amount that you just cited, but year over year it's quite a bit smaller. So I just want folks to know about this resource, and there are additional charts on the website.
And Amber?
Thank you, Andy. So I was just looking at the chat a little bit, and I know there were some questions about what entities have been part of the Healing Communities conversations. So as Dick mentioned, North Adams is a community. However, I think Boston Medical Center and many of us that have been working on this see this as a very much North Berkshire project, because North Adams is a hub, and some of our smaller towns and communities get their services 100% in our city. So we know it's beyond just the borders of North Adams, and it's important to think beyond that. And that includes all of our major medical providers. So Berkshire Health Systems, Breen Center, CHP, alternative living centers. I have a list in front of me. I looked it up. There were 52 people at the first meeting in North County. That's sort of the phase 0 meeting, if you will, around healing communities. And that's 52 engaged community members and providers from the area of substance use. So my point in saying that goes back to what Mary Beth was just talking about is that we fully understand as community-based organizations that municipalities here tend to be smaller and do not have like departments of neighborhoods or departments of social services or those capacities. And organizations like mine often fill that role. And so getting involved with us then supports that. You don't have to do it. We've already done the work and we're connected, and we can support that happening for those municipalities. Tri-Town Health, Jim Willis sits on the Community Health Initiative. And that is an organization that's doing the community health improvement plan for Berkshire County. And we've been working on that with BRPC and others, which includes addiction and harm reduction, substance use, all of those things, along with many other health related issues. But there's a lot of places to get involved. So I think when thinking about that, it's great for towns to start to look at who's doing that work in their community and how to then touch base with them and not necessarily stay just in that municipal conversation, because we will always make a seat at the table, pull one up for you, welcome you in 100%. So shout out to the nonprofits. We need you.
Carl, I see your hand raised.
Yes. We're a border community, as most of you probably are aware. And Vermont is literally a pebble's throw, not even a stone's throw from us. And in the region, which I specifically am talking about, would be Stamford and Reedsboro, who are a whole lot geographically closer to the North Berkshires. as they are if they were to go over the Searsburg Mountain and get to either Brattleboro, Bennington, or Wilmington. And I'm curious as to if Vermont has settled and if there is a mechanism for interstate cooperation. And I mean, we have this money and I want to spend it wisely and effectively. And I think that that is going to require a North Berkshire regional effort where we concentrate something to the effect of 60,000 residents between the communities of North Berkshire. And I would like to see some evidence-based positive effect because we have this one chance and I don't want to blow it. That's all.
So here's what I know about Vermont and its opioid settlements, and I can try to find out more. This is a great question. Every state's handled it a little differently. They are a party to these statewide settlements. I believe that they opted for a default where the state is basically taking 85% of the money and the municipalities are getting 15% of the money, which is different than the way it's being handled here. And I'm not sure whether the 15% is actually tied to abatement. They're using kind of a default structure where 15% goes into their state general fund, 70% goes to abatement, and I think 15 might go to the municipalities without kind of any limitations on the funds. But I need to double check that. So I will do that and I'll get the answer back to Andy.
Fair enough. Thank you.
Thank you.
But do you have a sense of if kind of cross-state border collaborations might be feasible, or is it too early to tell? I'm thinking the same with potentially New York State as well.
Yes, exactly.
I guess I would have to go back to the state subdivision agreement. I certainly think that it seems to me like it would be consistent with the spirit of the agreement, which is to try to expand services and help as many people as possible. But I don't think that there's anything in there that sort of is expressly on point. So let me take a closer look and kind of get back to Andy on that.
Appreciate that. Thank you.
And I see that we are drawing close on 4 o'clock. Again, we will keep the channel open if especially for people who would like to have further questions, or if you do want to start talking amongst yourselves about how you may want to potentially pool together various towns. But are there any questions at this point in time for our representatives from BSAS and the Attorney General's office?
Just a sincere thank you.
Thank you for all of your work.
Well, thank you, everyone. Again, we'll keep the line open if you'd like to stick around and chat a little more. Otherwise, thank you once again for your time. Again, later on, I'll send out the link to this recording, as well as the PowerPoint that we've gone over, as well as the presentations from the AG's office and from BSAS as well. And again, as always, we are happy to answer any questions that you have. You can feel free to email those directly to me, and I'll go ahead and pass those along to their offices.
Thanks, everybody. Lovely to see you.
I'm going to stop the recording at this point, but I'll keep the line open for those who are interested.